Hi Alexander, I have your week number 5 leg in front of me, and let's just step through this and see where the good and the bad things are. Okay, so starting, I guess at the top, I think we're okay, but I think we're missing a couple things, right? I think one, the depression back here goes quite a bit too deep for just general purposes. So really we'd see maybe greater trochanter in about here. And then remember, from this level, we're not necessarily going to go down any further, but we're going to be flat across. And flat across because that's the tendinous bit that the gluteal muscles grab onto, right? So from there, it kind of flares out at kind of an angle. Yours is just a little too deep and a little too steep on the upward facing planes. Okay, so we'll just fill that in a bit to bring back some kind of continuity. And when you look at it from this angle, that's a little bit more what I would expect. Okay, the thing that kind of jumps out though is that this area in here needs to taper in, right? So the tensor fasciae latae won't really be going outside further laterally than the greater trochanter. Right, it'll just kind of sit to the front and just kind of maybe in the same plane. Okay, so I'm just going to use the move brush to try to pull this mass in. It just gets a little bit too wide out here. Okay, and then that's kind of more what I expect to see when I look at this angle. Right, you see kind of I might have done a little bit too much there on this little vert. See kind of this taper, and then you see the first thing you're really going to pick up out here is the broad convexity of the vastus lateralis. So you'll have kind of gluteus medius down to the depression of the greater trochanter, and then a big pickup where the vastus lateralis starts to pop out. Okay, and I'm just going to go in with a little bit more kind of contouring here. Intensity's a little high. And often you're not going to get a big defined end or border to the tensor fasciae latae. Instead it'll just be kind of a gradual convexity, kind of a shallow convexity that sits over top of what would be the vastus lateralis. Okay, now let's just look a little bit more immediately from that. So I expect to see a little bit of the construction here. Whether it's explicit or not, meaning just setting up the planes for the rectus femoris, if this is indeed your anterior superior iliac spine, which it is. So really your rectus femoris needs to be coming in here into this area, right? If this is sartorius and this is tensor fasciae latae, it's going to be coming in here at this angle. Yours goes a little bit too far medially, and this kind of is going to go back to the vastus medialis right in here. Okay, I'm being quite constructive with this, just so that you understand where all the planes and volumes need to be shifted. I'm not really going to reconcile this against the reference right now. Okay, so that's going to be kind of the shift of the rectus femoris. And now, with the sartorius coming in here, we kind of expect a nice plane change between this, so I'm carving in a bit, and the adductors in here. And that's all okay. So adductors are going to sit right in here. Remember, adductors are coming off of the ischium, which is kind of the pelvic bone that sits down here. Right, and going up to the pubis. So these guys are coming down like so. Hopefully I haven't made them too big. I haven't. But what we're missing is kind of the flat plane that comes in here. And it just looks like this area is bulging out too much. So it's really, I guess, in essence, this right here might be coming in to be the pubic symphysis, or in that region, right? That's the kind of plane we're trying to establish. Okay, so I'm going to just give this a little pull in and see what happens. Adjust some of these volumes. Okay, and then I'm just going to take this in a bit more. Because really, if this is, remember, if this is the anterior superior iliac spine, that we have inguinal ligament coming down here, right? The big ligament that attaches to the pubic symphysis. And then we actually have the abdomen up here, right? So we have to set up those plane changes. Right, so this is going to be like rectus femoris in here, or sorry, not rectus femoris, the rectus abdominis, and maybe some internal oblique in here. You know, those kind of things are what's happening beyond this border. Okay, so that starts to pop that area out a little bit more. Okay, moving down to the knee, we just have a little bit too much flatness, right? Almost a concavity in here where the rectus femoris is coming in and the common tendon starts. Hopefully, if I just adjust the light, you can see that things are going a little bit funny in here and that everything is kind of flat and squished around. And really, we need to keep this broadly convex, right? Because all this is sitting on top of the shaft of the femur. And in fact, there's vastus intermedius underneath all this as well. So let's just pop this up. And I'll use the move tool for that. Let's see what happens. I might have to do this at another level as well. So I'm just going to make it with a very soft, broad move brush to make it a little bit more convex across the knee. And you can see that, hopefully you can see it's already started to improve things a little bit, making it a bit rounder. And the planes are reading a little bit better. Next thing, on the standing leg, the patella is kind of sitting at its own level, popped out in front of the condyles of the femur. Right, the condyles of the femur don't have space for it to slide in between on the standing leg, so it comes out and makes its own angle. Right, and I've just done that. I've kind of popped it out quite a bit, and you can see the plane change there now. And then it has to just blend in. Yours is still quite a bit too schematic, you know, because it is kind of encased in the common tendon up here. And let me just kind of bring this off a little bit. Put my light a little more frontal. Okay, now from here, when we get to the end of the patellar tendon, right, kind of this quadriceps tendon, that's kind of the end of the vastus lateralis, right? Yours continues to go down, and it does, but it kind of does this, right? So this is where it's attached to the tendon, and then it has to obviously arc back from there. And we get a little bit of vastus intermedius down here, filling in some of the volume as an extension. And then also, of course, we have the iliotibial band coming off of this down to kind of this area of the tibia, right? And the iliotibial band, if I'm just quite explicit about it, is going to be coming down kind of like this. I'm just using negative clay tubes right now to push this in, to give you the idea where it's flattening. That's going to be coming down and anchoring right here. Okay, and I'm just going to go back with a move brush and just taper this in a little bit. We've got a little bit too much flare. And moving down a little bit further, we need to really build up this tibial tuberosity, which is really the kneeling point of the knee, right? When you're kneeling down for any reason, you're kind of sitting on this bone, resting on this bone. The patellar ligament is going to come down to there. And then remember, filling in kind of this area, we have fat. And it looks like we actually have too much space between the patella and the tibia. So this probably needs to come up to about here. To make things kind of work proportionately. Okay, so if the tibia is up here, that gives us condyles of the femur in here, and that looks about right. Okay, so it's not a simple thing getting all these proportions correct and this construction, but after you've done it a couple times, it gets easier. And the knees certainly are complex, and it helps to draw them. So certainly just find some knees and try to almost do an écorché of the construction of the tibia and the condyles of the femur and all those good bony points. It's kind of why I assigned you guys that Dynamesh reconstruction. Okay, into the lower leg. It looks pretty good. I'm not going to say too much more. I think we've covered enough on the top, but I just want to make sure that these volumes are correct, and you have sartorius, or not sartorius, but soleus down here, and the big gastrocnemius head on the inside. And really, I've seen this problem a couple times already, is that people have just made tiny little bottoms of their tibia, and I don't know why it is, because it's not this small on the reference. This needs to be a bit bigger, a lot bigger to be actually weight bearing. Okay, so think about it structurally, if nothing else, that this needs to have enough size to bear the weight of this guy's body, and that's a little better. Okay, that's all I'm going to say on the standing leg. Now I'm going to bend the leg, and I expect actually that all this work that I put in here is going to break this. So we'll just see what happens when I transpose it, and sure enough, it breaks it. So let me just reload your tool, and we just take it from there with the new tool. So this is the new tool. And a lot of the construction that I already talked about applies on this one as well. Things like finding the boundary of your sartorius, going with clay tubes again, and really looking for the plane changes that this sets up. I don't just kind of make this stuff up when I talk about it. This really has to get in here and, give us adductors in here. And quadriceps on the inside, right? So teardrop is going to just border this perfectly right along this edge. Okay, I think that things have gotten a little out of control in the knee. Probably because you weren't able to see exactly what you were supposed to be making, but I'll just try to do a little bit of a constructional overlay to get this into a better place. Okay, so patella, it's okay. On the outside, we have condyles of the femur, right? So the lateral condyle is going to be here, coming up like so. And it's going to be in a plane almost like that, right? So that's going to be our base level, right? From there, we're going to, we have a little depression up here, but that's filled in with tendon. We don't really read it. So from here, we have to kind of put a little bit more distinction into the vastus lateralis, right? Vastus lateralis is going to be coming in on top of the lateral condyle, right? And it's still setting up a big plane change as it snakes over top of this. And actually, that volume that I've just put in separates itself nicely from the plane of the biceps femoris, which is going to be in here. Right, so that's always what I look for. I look for this volume, and then I look for this line and the transition going down. Okay, so vastus lateralis is going to take up most of this section of the thigh all the way up to the greater trochanter. Whereas you have the tensor fasciae latae comes down. Take a little bit of volume out of it, though. Okay, and now from here, let's just look up at the what's happening with the rectus femoris. And really, he's too ill described. He's just kind of he's sketchy, but he's too sketchy. I mean, there's something to be said for being kind of loose with your strokes, but not sloppy, right? So really what we want to do is we want to tidy this up a little bit, tighten it up. I'm just kind of flattening this area down. And then the rectus femoris is still only going to get a little arrow. I'm just going to go down, and I'm actually going to smooth this at a lower level to take out some of the roughness, so I can get in here with kind of a clean slate. So this is kind of the classic shape of the rectus femoris, right? Down to a point, and then this border along with the borders the sartorius. Then if you're going to have volume, and the volume just pops out a little bit, and you get a little tube, but the volume starts to kind of almost dissipate as it goes up, right? As the muscle gets broader and broader, it's not going to be as pronounced, and also it starts to dive in towards its insertion. Well, actually its origin at the anterior inferior iliac spine up here. Just making the break of the leg a little better. So I'm just taking the border of the vastus lateralis in a bit. Okay, so that's a little bit better on that one. Put a little more volume into this. And then just going to try to do a soft transition down to the adductors down here. And remember, this is going to get really fleshy in here, so we're not seeing really tibia or condyles because all of these muscles and tendons converge. Okay, next thing I'm just going to go down to a little bit of a lower level, take a big kind of move brush, and I'm going to push the tibia in a little bit. So move all this back so we get kind of a little bit of an angle on the bent knee, because this starts to settle into the space in between the condyles a little bit. Right, so we get up kind of an angle, not 45 degrees, but a little shallower as the patella slides back, and then the top goes back up to the quadricep muscles. Okay, and I'm going to tuck in this lateral condyle a bit. Then again, we're looking at a lot of the same stuff that we did on the straight leg. That's reestablishing the kneeling point, kind of getting the volume of the tibia correct up here. The bone comes also out laterally, right? So this tibial plateau makes a nice kind of crest for the lateral condyle to rest on, but also this crest sets up the space for tibialis anterior to sit into. Right, so that's going to sit in here and kind of come a little bit anterior to the border of the shin, right? This tibial line going down. Okay, and from here, kind of a little bit of a softening, because all of this is packed together with ligaments and fascia, and there's fat in here, so some of this has to soften up a little bit. And again, remember, we have also iliotibial band still coming over top of the lateral condyle. We're going to be doing something like this, right? Again, I'm being quite explicit, but just to show the idea, then this kind of will soften out, just masking some of the forms a little bit. Okay, that's a bit of a reconstruction, and I will just leave it at that. I hope that was a good walkthrough to show you kind of where you were missing some of the critical points and where your models can be improved, just to get some of the construction back in. Okay, thanks for the hard work, and I will see you after the break.